I joined the Marine Corps. I began to study electronics and I got into some really good jobs, had some substance issues, which go along with my diagnosis of bipolar 1. I had become homeless at one point. That was probably some of the hardest things that I've ever had to go through.
This could be the veteran who lives next door. This could look like someone living in a travel trailer in a campground that may not have running water or electricity. This could look like someone who's using the hospital frequently. Doctors and nurses know them by name, but they haven't disclosed that they're struggling with a safe place to sleep every night. These could be people staying in long-term hotels where they can make that monthly rent in the winter, but not in the summer. Our area, the Rocky Mountain region, housing instability looks a lot like aging veterans on fixed incomes who once could afford housing on that income and no longer can due to the rising costs. Our homeless programs have worked really hard over the years to work with the community to identify some of the barriers that veterans and civilians are facing. So we have to improve quality of life. We want to make sure that every veteran in our program has access to medical services. So making sure that they have a PACT provider assigned, making sure that if they qualify for home-based primary care, that we are advocating for them to get into that program, making sure they're attending those appointments. Are there barriers of transportation or what's getting in the way that they keep missing the appointment, right? Again, this population is aging, so sometimes it looks like, hey, maybe this person can't independently live anymore, and now we need to move toward assisted living or something of that nature. Our goal is for permanent housing. And so case managers in a VA homeless program will not only work with landlords, help with applications, get people into housing, work with community partners to pay the security deposits and get them furniture and beds, but we want to look at, okay, you have housing now, that's great, that was the goal, but how are we going to keep you there? How are we going to improve your life now? And that's really where we see that goal can be reached.
Through that and some hard work and some really good guidance from the VA and the help through the homeless program, things started to turn around.
Through his healthcare and his healthcare team, we've been able to establish his benefits, and he's gotten his service connection. He's been stable for years. I have never seen him so happy in his life.
My future is bright, and I know that because I've had a ton of support from the VA.
So if I were to encounter a veteran who is facing housing instability, I might tell them that you're probably not alone and that there are resources here at the VA for you. And honestly, if you don't use the resources, they might go away. And so we want to capture these people, right? We want them to know that these resources are here. And so to start the conversation, I think it usually depends upon a trusted relationship. And so whether you have a good connection with your nurse or with your primary care provider or your social worker, please speak up. If they don't know the answer, they may find it.